Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We have a very special program today. You know, over the years, and now we're into our 23rd year, maybe almost the 24th year, the three areas of significant, I shouldn't say that, every request from you, the viewers, we try to give you some knowledge. But still, the top three are cancer, cardiac disease, and believe it or not, it's not a disease, but they want to know about minimally invasive techniques and surgery. So today we have an excellent representative representing the cardiac issues, but also minimally invasive issues. And let me introduce to you Dr. Kayvan Amini, DO, a very proud graduate of Nova Southeastern University. So welcome, doctor.
Thank you so much, Dr. Lippman. What a pleasure to be with you, and a true privilege to be with your audience today.
Thank you. We want to talk about the changing, I guess you could say, vision and direction of cardiac care. So it's all yours.
Well, I think, it's a fantastic point you bring up, Dr. Lippman. However, I think it's not just cardiac care. I think it involves a paradigm shift in healthcare and medicine. And I've labeled it, what I've came up with, what I call a mantra. And the mantra really, the acronym stands for minimally invasive, accountable, where patients are actively participating in managing their own care and they're self-accountable. Non-invasive, so we're kind of getting away from things that were invasive and testing and procedures that were maybe a little bit excessive and could cause harm.
Yes, telehealth.
Telehealth and telemedicine. Also, we're moving towards, I think, artificial intelligence, augmenting our care, and hopefully, and again, I say that hopefully, not replacing what we do, but augment our capacities and abilities to treat and diagnose. Ultimately, it's going to be a wireless process where care can be given any location, anywhere around the world, and you could receive the top care, and you could have ability to monitor and be self-accountable as you go through the journey of your healthcare.
Well, the reason why I want to stay on that subject, the reason why it's so important is because, here we are at the south end of the state of Florida, which is a huge geographic state. I mean, when you go from Homestead to Pensacola, you're halfway to Chicago, actually. But the availability of healthcare has diminished to a great deal from what the traditional healthcare of maybe 15 years ago was. Hospitals, medical offices, but they were dispersed and they were underserved areas. And a lot of people mistakenly believe that underserved areas are in the poor sections of cities or whatever, or rural areas. No, they're all over the state of Florida. You have a lot of underserved areas above the I-4 corridor, which is really Orlando to Tampa, all the way up to the edge of the state. Maybe not in Pensacola and Tallahassee, but you have a lot of needs, and I think the future relates to exactly what you were talking about, especially since we have come to a point where we understand that the individual practitioner, doctor, dentist, whatever we have, we're not just single, we are collaborative. And I know how you feel about that.
You couldn't be more correct about that. And I think that this is one of the challenges that you brought up, that I think regulators, various medical leadership associations, local associations and local leadership, universities, I think the entire healthcare industry sees this challenge and they're working on it. And underserved isn't just, I believe, those areas. Underserved communities where there are physicians, but not enough physicians for the population, especially with the recent changes in demographics. We know that we're foreseeing a significant shortage of physician need in the future, from cardiovascular disease with the booming age and capacity for medicine to prolong life and extend life. So we are heading towards a real big challenge. I'm confident, medical professionals and the healthcare industry is so genius when it comes to being creative and trying to create tools to augment its capacity to meet these challenges. So I'm confident we will. But I think there's going to be shifts in healthcare as we go forward, changes in various related matters when it comes to regulatory policy and healthcare insurance and coverage, so we can get this and suffice this need that we have in the state, but also in the country. It's not just unique to our state. I'm fortunate enough, I sit on multiple state boards and committees, fortunate enough to be appointed to these positions to overlook some of these things, give my input and experience into it. So I get to see some of these issues when it comes to coverage, healthcare coverage, pharmaceutical coverage and cost, the expenditure for the state, the Health Information Exchange Technology Committee that I sit on, overlooking this capacity for the state and insurers and various other stakeholders to monitor patient care. So I get to see this, and it looks like technology will be something that's going to assist us in the gap. But I also believe we have to encourage populating the Medical Education Committee. We have to encourage people to go into medicine, minorities and everybody else to encourage, because there will be a significant shortage. And that's where I think our medical education system is working hard to gather enough people to supply our needs.
Well, I usually don't just talk about Nova Southeastern University, because we have a lot of wonderful partners in education, particularly in South Florida, whether it be the University of Miami or whether it be FAU, FIU, et cetera, et cetera. But I just read statistics the other day, because our college, the original college, we have two colleges of medicine. We have the College of Osteopathic Medicine, the College of Allopathic Medicine, but really they have now joined together. Finally, I'm not going to get into that, but the reality is that you have a situation now coming out of Nova Southeastern University where we have the third largest medical school in the United States because of our footprint here in Davie and the footprint we have in Clearwater. So when you realize that, every one of our graduates matched, just so that the audience knows, we're talking about people getting the opportunity to do residencies. That's the matching process. So I know that a lot of things have changed since you walked across the stage and we said congratulations, but I think the changes are very valuable to the abilities of the people who tend to view us on a weekly and monthly basis, because all they want to do, don't forget, just talk about the state of Florida. State of Florida has the highest number of people over the age of 70 in the United States. It has that's percentage-wise. It has also the highest number of people over the age of 85 of any state in the union. So you can see that the viewers ask us questions because when they come here to live out the privilege of their life, they want to be not sitting in a chair or being just looked at. They want to be participatory in our society. And that's why it's so important to have this opportunity to provide health care to this broad section.
Look, there's no doubt, as an alumnus of NSU, I can't tell you how proud I am to be part of the university and the impact it's had in my life, and how proud I am to see it grow in fruition of producing so many various healthcare providers, from allied health to physicians to MDs to DOs, to care for our community. And I'm incredibly proud of that and achievement. And partly, I do have to give credit to you, Dr. Lippman, since you've been heading the health professions for so many years, and you've been a major contributor to this, and I'm sure your audience already knows that. But this is a complex process. You mentioned the average age of Floridians and the more senior community being down here. And we know when it comes to healthcare and where cost matters, 80 to 90% of healthcare cost is consumed in the latter 10 years, 10, 15 years of life. So this is a heavy burden for our state. It's a heavy burden for our country. We can't shy away from that. This is a multi-pronged process. One part of the process is a supply-need mismatch, which we discussed, and Nova University and KPCOM is doing a fantastic job trying to relieve that issue. At the same time, that's not enough. What we need to do is impact really the global concept, which is versus, looking at prevention versus treatment. We have to focus on preventative means and mechanisms, especially for that population, to prevent some of those highly expensive, high mortality, high morbidity issues. And I'm going to review some sobering fact for your audience. And my focus is cardiovascular disease, so I'm going to focus on that. But I'm pretty sure most of my colleagues can give you similar data and statistics regarding their specialties. But we're looking at between 2030 to 2035 of expenditure of $800 billion to $1.3 trillion for cardiovascular healthcare. 40 to 50% of the US population will have cardiovascular disease. 119 million people currently have hypertension, with only a quarter controlled above the age of 20. One in person, approximately, I think the numbers are around 30 to 34 seconds, one person dies of cardiovascular disease in the US. 90%, maybe more, 80 to 90% of cardiovascular disease is preventable or delayable. And less than 7% of the population has optimal health care or health manners when it comes to current guideline and recommendation. That's 1 in 14 only really are optimal where they need to be addressing their diet, nutrition, exercise, and basic care. And again, I want your audience to understand when it comes to cardiovascular disease, which is so close to my heart, as you know, 45% of heart attacks can be silent. Not your typical symptoms, and people are not aware of it, with a high mortality rate. And coronary heart disease remains the #1 killer in USA. Over 380,000 people die every year. 805,000 people get heart attacks, and 25% of those get recurrent heart attacks. So we have so much work to do on prevention. And just another kind of interesting fact to throw out to your audience who cares about healthcare. December 25th and 26th and January 1st are the top 3 dates of heart attacks. So just, we're here to educate. And the more people know about symptoms, what to look for and watch, we can try to either diagnose, catch, prevent, or ameliorate some of these issues.
Dr. Amini, that, if you don't mind, maybe in I don't want to say in an oversimplistic way, but in a manner, could you just relate to some of those issues so that the public out here knows, oh, well, gee, I pulled my shoulder, or I had a little thing on the back of my, I can't move. Explain what you...
Of course. Well, cardiovascular symptoms when it comes to cardiac ischemia or heart attack, which means a blockage leading to a heart attack or blockage that hasn't met, can present many ways. It can present from chest pain, pressure, sharp, dull, anywhere around the chest. It could be symptoms in your left arm. Typically, right arm is not likely to be, although we have atypical, which means non-typical cases in female and women that we see that. It could be nausea. It could be abdominal pain. It could be feeling fatigue. It could be shorter breath. It could be dizziness. It could be headache. Migraine is a presentation in many women as their first sign of heart attack. Visual changes, palpitations, shorter breath, getting fatigued, getting tired. I've had plenty of athletes that I take care of who their capacity to exercise is still much more fit than I am, but yet they notice the drop, and that essentially develop heart disease. So even though they're performing at what I would say is probably 100+% of the average population, for them, it was a 50% drop. And so you have to listen to people. You have to listen to what they say. Every individual is unique and different. So people need to realize that, your audience needs to realize that we're not exactly the same and all the same. We should all have similar values and concepts of life, but when it comes to how we feel with our symptoms, we can all have different presentation, and each human body has a different biochemistry in response to medications and treatment. And you got to be accountable for that. So if you don't feel well, and I know you've said this many times, don't wait, seek attention and help. And it's possible, best scenario, it's not. But a really good scenario, you catch something in advance.
I've been ending the broadcast looking out at the audience and saying to them, please talk to your doctor. Don't just let it, if something comes up, talk to your doctor. Some people say, well, I can't speak to the doctor because he's busy or whatever. No, stick with it. Do you have your annual checkups? Do you have your semi-annual checkups? You need to do it. I mean, I'm really very pleased, even though this is related away from cardiovascular disease. But the women of our nation have learned that they need to have mammography, all right? So they will. John Q. Citizen, I tell the people all the time, if you don't feel well, just don't walk into a supermarket or walk into a pharmacy, pick something up from the shelf and think that, oh, well, I get some minor relief. Oh, the headache went away, my shoulder is much better, whatever. No, talk to your doctor, please.
That's I think the basic point. And the only way I would capitalize on the exact sentiments that you have is, look, life is challenging. Most of us struggle with the day-to-day odds and ends of life, and some of us can't comprehend what each other, what we're going through. So I get it. I understand. My message to people and my patients, and if I'm on a radio broadcast and I've done shows and different things on iHeart and various other issues, my message is very similar. It's not about the heart. It's not about the money. It's not about the clothing and how tight the clothes feel and what you want to wear. It's not about what other people think. It's all about hope. It's about the individual and not giving up. It's about realizing it's never too late to make a difference in your own life. So cut yourself a break and give yourself a chance. It's never too late to start. The time to start is today. And with that in mind, it's a simple concept. You don't need to get a gym membership. You don't need to take some drug to lose weight and improve your health. I'm all about enabling the individual to be fully empowered, to have the ultimate capacity to pursue their dream by being healthy. And it's simple. The changes you can make, just worry about the simple changes you can make. Look at your diet. Maybe just cut back a little bit on the salt and don't put salt on your food today. Cut back on a little bit of the trans fats and other kind of fats that most of us know what's not good for us. Try to exercise a little bit more and don't take the elevator, take the stairs, walk a little bit more. Cut back on the smoking if you smoke. Get a blood pressure machine or go to Walgreens or CVS and check your blood pressure if you never have. You might be surprised. We know what we individually believe is being overweight. Just watch your weight, watch your build size and see if you can address that. Cut back on the stress, cut back on the alcohol, consider getting a regular checkup. And something else that I believe is a big issue when it comes to healthcare and the disease process that many don't talk about, but I will talk about, is sleep, and specifically sleep apnea, because we know how underdiagnosed and how prevalent it is, and how it can lead to heart attack, stroke, heart failure, mood changes, depression, fatigue, arrhythmias, and on asthma. And that's something, that we can talk about either this session or a different session, but I want people to at least make an impact on one of these variables. we're born the way we look, and we're born with the skin color, and maybe we're born tall and short. We're born male, female, or any identity you believe. However, there are certain things that we do as a habit that we can modify. And like I said, 80 to 90% of cardiovascular disease is preventable or delayable.
You know, also, I know that you spoke about it, but you know, many people, who, particularly in South Florida, with the heat that we have, we don't swallow enough liquids.
Hydration, just like the planet, 70 to 75% of all of our organs and cells are consumed and full of water. So water is a necessity for us to exist. Water is our oil and our fuel. We have to have it. So hydration is critical. We're even seeing in cases now with data and study coming about sodium reduction, which was such a critical issue when it comes to heart failure, now realizing that, a little bit of fluids is okay. And we don't have to be so strict on salt, even when it comes to the concept of heart failure. For your audience, that if they're aware, where if the heart's weak and the pump doesn't work and things back up in the body, including water in your lungs. So water is a critical substance, and that's free for most of us, unless you want to buy bottled water. But then again, take advantage of the data and information that's out there. Look at the internet, look at various sources, and touch base with your physician, and make sure your physician's on par with some of these recommendations and hydration and supplementation. There's so many good supplements out there that supplement hydration, that can improve what your body is. And if there's a point I can make, I think we're going to come back and we're going to realize inflammation in the gut is one of the most critical things when it comes to cardiovascular disease and other disease processes, including cancers, diabetes, and etc. So I advise everyone on this panel listening to this broadcast to think about inflammation in your body and what you can do to reduce it, from reduction of stress, fish oils, various supplementation that we can discuss at some other point. But look into these matters.
So, Dr. Amini, we're getting down to the last parts of the show, and I'd like the people to understand that you're just not a person that's here as a physician and a clinical assistant professor at NSU KPCOM, but you're vitally involved in setting the, shall we say, the force effort behind healthcare by your involvement at the state and local level and within your professional associations. So can we touch on that?
Absolutely. Thank you. So, I'm involved at the local level as the president of the Broward County Osteopathic Medical Student Association, also lecture at the state level. I represent at the national level as a delegate representing healthcare, and the state level as a board of trustee for the Florida Osteopathic Medical Association. I'm also very fortunate and privileged as I was appointed to a couple of committees, and one of them, I'm the vice chair for the state of Florida's Drug Utilization Review Board, and also I serve on the Health Information Exchange Committee, where I'm involved in technology and matters and related to patient care and everything else through the state, along with advisor for health insurance companies. So, I'm quite, I'm all over the place when it comes to physician and healthcare representation, to education and educating our community, our state, to being involved in various committees and boards to regulate our healthcare and regulate the focus on patients and consumers, and making sure that we're doing the best to take care of them, along with representing healthcare and physicians at the national level when it comes to policy. And I can't tell you how humbling and what a fantastic opportunity it is to be involved and engaged. And this is what I recommend everyone that I mentor and discuss: to get involved, contribute, get engaged, and make an impact on your community. We only have one life, and really happiness is outside of ourselves.
I'm so pleased that you're involved in these multi organizations, because it really needs people of quality. I happen to know of your quality as a cardiologist, as a physician, but the people need to know also that you're giving of yourself for them. And to me, I want to say thank you.
It's a privilege. It's a privilege to serve. It's a privilege to have an opportunity to have people entrust their life, their greatest secrets that maybe they don't share with their partners, and give that up and have that faith and trust to care for them. It's incredibly humbling. And I don't take that for granted. And I always preach to our medical staff and medical students and trainees that taking care of a patient is a privilege.
Well, and it's been a privilege having you here today. I'm sure we're going to get a lot of questions that'll come to us. Folks, I always say, you know, we have this email address and we have this phone number right here. If you have any questions, we can't answer it, but we might send them on to Dr. K. Amini, otherwise known as Kayvan Amini. But we had the opportunity to bring someone in who provides the holistic view of healthcare, and I felt that this would be a good time. We're now coming out of the suffering mentally and otherwise of the COVID crisis, and hopefully you take heed and take good care of yourself and talk to your doctors. And remember, this show is called Dateline Health. My name is Fred Littman. Until next time, see you.